All right, hi. I'm Dr. Ashi, and I'm here with Dr. Oscar Anderson. Thanks for joining me.
It is my pleasure. I've actually been looking forward to this.
Can you just tell me a little bit about yourself?
I've done most of my clinical work in community mental health settings, school settings, and more recently private practice.
Hmm.
Um, and my area of training was actually in sexual abuse and learning disorders. But as part of my learning disorder assessment, there was a general like neurodevelopmental shtick that we had to take onto it.
Hmm.
And that really ended up resulting in doing a lot of work around autism, a lot of work around ADHD, a lot of work around learning disorders. Um, and then through the sexual abuse work I did, there's a lot of complex trauma, a lot of domestic violence, and then and I naturally have a bunch of queer people that end up on my caseload and have always been on my caseload. Probably helps I'm queer identified myself. I don't think I have any current therapy cases that are not neurodivergent in some way, shape,
Hmm.
or form. So I also want to draw a very clear distinction about like neurodiversity when I'm actually talking about here. I'm talking about the general umbrella of neurodiversity. So we're looking at like C-PTSD, autism, ADHD, the shtick, the works. So it is a pretty broad category, but most people I work with, I would say probably about 75% of them, 75% either have autism, ADHD, or C-PTSD, or some combination therein. And I honestly think I have maybe three straight clients on my caseload.
Yeah.
And almost all the youth I work with are gender queer and gender diverse as well.
Okay, so before we get into neurodivergence and autism and gender, I just want to ask a little bit about you. Do you have a particular story that when you think about it, from maybe your childhood or something, it kind of makes sense that you became a therapist? Like what got you into this field?
Well, I'm nosy as shit. Um,
Yeah.
that really is a lot of it. I'm overly nosy. And then this is something that always came naturally and easily to me. My mom was a special education teacher, so I've always like been exposed to like special education, alternate learning. Always been like very closely related to the psychology field. Her area of emphasis is more of education and biology, but
Hmm.
so just kind of like growing up with like having like all this be very like normalized, very talked about. Is something that was pretty standard for me.
Yeah, so you're kind of in this world a little bit from your mom and being around other people that would be on the spectrum of neurodivergence. It was something you kind of
Mhm.
were exposed to.
Yeah, I would hang out in her classroom all the time because she would often teach at the same school that I went to, for better or worse.
Hmm.
And so when I would go to her classroom and just like hang out with the students who were there, made sure I was respectful, and then she would also explain what was happening. That way, like if I had any questions, I would know how to ask it.
Hmm. And so when you say that you're also nosy, what
Mhm.
is how did that materialize when you were younger?
Um, I was always in other people's business for no reason. Um, so especially with my family, lots of questions unnecessarily,
Hmm.
asking more than what was probably needed, just because like I wanted to know. And then I think that naturally progressed into a lot of anti-authoritarianism, where if somebody couldn't give me like an adequate answer for the question I was asking, I simply would not follow what they said to do,
Hmm.
which has worked really well for me as a professional. But it tends to get me in trouble sometimes, both now and growing up.
Yeah. I mean, I think maybe one way of framing that too is that you're just a naturally curious person.
That is the nice way to put it, yes.
I think it genuinely comes from a place of curiosity and wanting to just
Mhm.
connect and understand people. And at the same
Mhm.
time, I also think for people that are uncomfortable with that, they could probably see that as being nosy or like picking in areas that we're not supposed to go to.
Mhm. Yeah. So I guess to that point, yes, it comes from a place of natural curiosity. I think it also probably gives some insight about how things were framed for me growing up a lot of the time, about like what I should or
Mm.
should not do and a lot of the rules and expectations that were supposed to have been followed. Um, so while I affectionately call it nosy, I also recognize that like still this coming from a place of was there actually space given for me to like talk about things the way I wanted to talk about them, to do things the way which I wanted to do them, and how was that received by other people?
So I definitely see that in our work. You can be very passionate about standing up for your views.
That is the kindest way I think anyone could have phrased that. Thank you.
Well, I think what we're going to talk about too is advocating for people that are different, and that
Mhm.
includes being neurodivergent. I don't know if you would put gender non-conforming people as a form of neurodivergence. Do you have any thoughts about that?
No, there's a lot of overlap, but they are not the same thing. That is actually part of the crux of what is happening politically, is being like gender non-conformity or gender diversity is being seen as like a form of like mental health issue or a form of
Mm,
like something's wrong or something's different. And while there is a difference just because people are different, it's just a form of gender expression. Whereas neurodivergence is oftentimes a traumatic experience or is formed by trauma itself. So, like for example, ADHD, learning disorders, autism, Tourette's, the neurodevelopmental disorders, those by themselves are not traumatic. They are not trauma diagnoses. However, the way in which people respond and react to that often induce complex trauma. They often induce chronic trauma. There's often a lot of depression, anxiety, self-esteem issues that come from that because we don't live in a society that actually accommodates for those disabilities.
mm,
So then what actually happens is we see a lot of conflation of trauma symptoms with neurodevelopmental symptoms rather than like just the neurodevelopmental thing by itself. Which is why when we're doing assessment, I will always screen for trauma in addition to the neurodevelopmental bits because I want to know how have they been protected or not. When you're trying to make sense of the world that does not respect you and does not actually take care of you, and you have to have a different approach to it, you're naturally going to think about yourself in a different way.
mm,
So oftentimes that comes to their presentation and people actually respond to us, particularly women. So
mm,
if the world is like telling like you as a woman, like you're supposed to do this, and this, because you're a woman and you aren't following that, you then have to make your own meaning of gender. Sometimes that means that you just have a lot of gender nonconformity. Sometimes it means you overly conform. Sometimes it means you, upon introspection, you sit there and you think about it and like, actually, this is not me. And I think that this is more of like what my identity is. So that's why there's more of that overlap. Not necessarily
mm.
because there's like a higher occurrence of like gender diversity with neurodevelopmental stuff, but there's a lot more introspection and people have to put more thought to it because of like how we understand social norms and like social conventions.
Mm. Yeah, that's something I've never thought that much about. And it makes me, there's so much overlap between these things that
Mhm.
it kind of, this might not be the best example, but
Sure.
something that I thought of was handedness, that you could be
Right.
left-handed and live in a culture. And I know there are cultures, I'm thinking of an example. So when I was young, I lived in India, and one of my friend's mom was naturally left-handed.
Mm-hmm.
But in Indian culture, you're not supposed to use your left hand for things.
Mm-hmm.
And so she was beaten by her parents when she would use her left hand to just navigate the world, right? Because she was left-handed. And so she ended up developing right-handedness. It wasn't really real right-handedness, but she was really traumatized from that experience. And I could see that forming an identity that's something that's actually natural, but might be different from other people,
Mm-hmm.
that on top of a society that oppresses that feature because it's different or it's considered
Mm-hmm.
wrong in some way, that compounds or adds trauma to the experience of being yourself and being divergent, I guess.
Yeah. So like, I actually think it's a pretty good example because that's one we can talk about in like mostly pretty normal ways at this point. As we're like actually talking about like the neurodivergent experience, we really need to understand like the judgment that like neurotypical people have, as well as the shame that that then induces in neurodivergent people, and then how they actually bring those points to the conversation. Because if you need an accommodation, you need something to be different because you're overwhelmed, you're overstressed, you're overtasked, but you don't feel like you can talk about it, then you're just going to continue falling behind and behind and behind. And then you also have to like disclose part of your identity to somebody who might not actually want to disclose that to in order to be accepted, rather than us naturally giving those accommodations and naturally having the flexibility that we would be having.
Okay, so to kind of anchor this conversation, how would you
Yeah.
define neurodivergence?
I think at its core, it is any structural difference in brain in your brain or any chemical differences in your brain. I'm hesitant with that one though, because that is so incredibly broad that everybody then qualifies as neurodivergent. But I also think that's kind of
So,
the point.
mm, mhm,
Um, I think it's probably easier to think about like degrees of neurodivergence and like things that are like the most accepted by society to things that are least accepted. And so a lot of the times
mhm,
people with depression and anxiety, those are pretty well accepted. But depending on how they formed and what actually caused them, those are actually forms of neurodivergence by themselves.
mhm,
And then there's your I'm gonna feel gross saying this, like the autism that makes you like fun and quirky and special. People
mhm,
tend to actually do pretty well with that one.
mhm,
But the second you see some of like the more like negative symptoms of that, like the
mhm,
social difficulties or the social avoidance or like the getting stuck, things like that, that will kind of like shoot you down to like this like bottom tier in society. The ADHD is like this like fun like golden retriever energy. People tend to like really respond well to, but then you actually see like the functional difficulties with that,
mhm,
and people do not accept that. So when we're talking about neurodivergence, technically it's any structural difference that your brain has or any chemical difference. I think there's degrees and variations though, because the umbrella is pretty broad. Like anybody that we're working with in our field, for the most part, is going to be neurodivergent, with the exception of couples with basic communication difficulties.
mhm. Yeah, it's really interesting stuff is because it's not just about how you're different, but also the way in which society responds to those differences. And
Absolutely.
someone with the same, diagnostic label, right? Autism, one
Mm-hmm.
spectrum of what they're like, which might be perceived by others as quirky or even genius, might
Mm-hmm.
then be viewed very negatively when it comes to, facial affect and
Mm-hmm.
communication style.
Yeah, 100%.
How would you define autism specifically?
My like automatic thought is actually to refer back to the DSM,
Hmm.
but it is such a flawed book. I don't want to.
Hmm.
Um, I think there's some good credit with that. So I think we want to look at it from three different places. So the first is going to be just like neurological, just basic neurological differences. So that's going to be sensory sensitivities. That's going to be routines. That's going to be getting stuck. That's going to be difficulties controlling emotion. That's going to be difficulties managing habits, difficulty managing yourself in some way, shape, or form. Just like the way that your nervous system basically regulates itself. I think
Hmm.
that's kind of the first area to look at. The second area is technically all falls under like social stuff, but I think it's easier to talk about through language and communication and social relationships. So language and communication is going to be more about how you actually talk to other people, how you understand uh, language, how you understand like the way you communicate. This is where we're going to look at hyperbole and metaphors and tone and all like the more subtle nonverbal cues that are related to social relationships. For the actual social relationships piece, this is where we're going to talk more about how do you actually navigate friendships? How do you understand relationships at a very fundamental level? Is the person you came out for 5 minutes, are they your friend now, or are they just like a friendly acquaintance?
Hmm.
And like, how do you actually define what these relationships look like, and how do you actually like navigate them in your life? And something that a lot of people with autism and also borderline personality disorder kind of have, or other like borderline styles, is like a favorite person where like that's like the one person they really cling to, and that's somebody who like they really like uses like this like really good example of like a friendship should be or what it should look like. But I think if we're looking at like all those things, we're looking at like how does somebody respond to others, and so not in the socially conventional way, or somebody has to engage in a lot of like sensory regulations, or like their nervous system has a really time regulating itself. That's where we would start with disability autism.
I also wanted to talk about gender because there seems
Mm-hmm.
to be a correlation between autism and gender non-conforming. And I see a lot of stuff online about this that's very inflammatory, and I don't know how much of it's accurate. And so I wanted to talk to you about this. So first, before we get into the autism piece, one of the big conversations now is about gender and sex. And so can you explain what gender is and how that is related to or distinct from biological sex?
So sex is your pure biological characteristics that includes chromosomes, that includes genitalia, that includes testosterone and estrogen levels, that includes androgen levels, that includes all the biological and chemical makeup that goes into a body.
Mhm.
That is your sex. Gender is the social perception of that, as well as your own experience.
Mm.
So we have gender expression and then gender identity. And those are two different aspects of gender. So, like, use myself for example. I actually present pretty relatively masculinely. Like, I'm wearing traditionally masculine clothes most of the time. I dress and like I keep my hair done pretty traditionally masculine ways most of the time. Um, I don't really wear makeup. I don't really do a lot of things that would be considered like more feminine.
Mhm.
So my gender expression is fairly masculine because that's what's comfortable for me.
Mm.
However, my actual gender identity is pretty disconnected from that. That's not how I experience myself at all. So
Mm.
when I think about myself, I don't really think of like gender is not actually not really part of the equation when I think about myself.
Mm.
So, and I know that that is not the way that everybody thinks about themselves, and gender can be something that's really important to them and like important to their experience. So that's why I identify as non-binary and use they them pronouns, is because like I simply don't connect with that.
Mm.
Where somebody else, they might have that same experience of not really connecting with a gender identity, but because they're pretty comfortable with the way that they were assigned at birth, they may actually still use that same gender identity because that just makes sense for them. And it's fine.
Mm.
And then the presentation of that could be different. So this is where we get involved like tomboys or femboys or your pretty stereotypical like queer presentations, where the presentation is something that's very much for trans people or very much for gender non-conforming people, or rather than for cis heterosexual people.
Yeah, I think that's something that's interesting that you just said is I understand the gender expression because
Mhm.
I think we can all see how people express themselves differently and there's a spectrum. Even people could see that there's different ways of being like a cisgender or straight guy, that
Mhm.
there's lots of different ways of just being a guy. And
Mhm.
when it comes to gender identity and how you feel and connect with this concept of gender, I think that's interesting because like I'm just a cisgender guy. Actually,
Mhm.
when I made my first Facebook account back in like 2008, in the about me, I didn't know what to write, so I just wrote I'm a guy. Which is kind of not when you're saying it now, it's kind of interesting because for me, I never really thought deeply about what it meant for
Mhm.
me to just register myself as a guy. And I fit my ideas about what it is to be a guy. I fit society's idea about what it is to be a guy to a
Mhm.
large extent. Um,
Mhm.
this notion of feeling yourself in gender not really being like there in some kind of concrete way, I think that's hard
Mhm.
for me to understand. And I
Mhm.
also think it's something really interesting. Clearly, there's so many people that experience this. This is why we have non-binary gender now.
Mhm. Yeah, and I think something else we can also think about is we can actually think of American culture as having four accepted genders. And I do mean this genuinely. So we have childhood and adulthood,
Hmm.
because again, we're looking at the expression of what our internal sense of self is. And that is what gender is. So we have boys and girls and men and women. And as long as we line up with like the things that like we typically think of for like how you're assigned those different genders at birth, that is how you tend to carry that forward. So I remember growing up, I was actually pretty comfortable with like a boy title. I was very comfortable with that. And as I think about my own childhood, I would still say like, yeah, I identified as a boy at that time. And then once people started using like man gender descriptions for me, I started getting more and more uncomfortable because just something about that shift for me felt off.
Hmm.
So you can see the same thing a lot of like with girls and women, especially once they become like sexual objects. Oh, don't like the way I said that. But also, I think that's part of the conversation. Is like once we begin thinking about sex and being sexualized and how society sees you and then proceeds to objectify you, that can be a part of your own gender experience and part of your gender presentation. And so a lot of people will actually shift away from like a more cis typical experience because of that. The way that other people respond to you is such a big part of gender. So while gender at its core is like how you identify, people's response to you, I think, is a fundamental part of that. And so to kind of like connect this back to like neurodivergency and gender, if the way other people are responding to you does not line up the way that like you experience yourself, or their expectations of how you should be do not line up with that,
Mm,
you're going to be forced to have that reconciliation in a little bit of a different way.
mm,
Especially if we're thinking about like the rules of gender, like there's so many rules that exist around gender, and that's actually part of like a deep frustration I have with it because when I'm working with men or frankly with women, and they're like, okay, but like this is like how I do things. I'm like, okay, but why? Just because somebody said you had to? That's ridiculous. Don't do
mm,
that. Um, and so like so much of like work around gender and gender identity, especially for trans and non-binary people, is like, well, you're doing this. There's a reason. Are you doing it because you want to, or because somebody's telling you you have to? And like that's the way that
mm.
you're responding to other people around you.
What do you see as being a potential correlation with autism and being gender non-conforming?
How you have to think about yourself. It's fun how other people respond to you. I really do think that's the biggest correlation there. Because
Mm,
outside of that, like being neurodivergent does not, by any stretch of the imagination, mean that you are going to be gender queer or queer in general. By the same extension, that being queer or gender queer does not mean that you're going to be neurodivergent.
mm,
If you really have to sit down, like think about yourself and think about the way in which you respond to the world, you're gonna come to some realizations about yourself and like whether or not you actually follow the rules.
mm,
So I think looking at sexual abuse is actually a pretty good one for this. So if you are somebody who's been sexually abused, you're then going to really have to sit down and really think about what is your place and like what is your role in society and how do you actually understand that. For some people, when they think about it and they start thinking about what it means to then be a woman or a man who has been sexually abused, they may come to some realizations about themselves that are going to lead to gender queerness. However, that is not absolutely not going to be the case. It's just because they've been forced to think about it. And maybe they had one to thought about beforehand and they would have just been pretty casually like, I might be non-binary, but I work a 9 to 5 and need to pay rent, so I don't have time to think about that.
mm.
And I realized like what time do we have to think about it? What time do we have to reflect? Like and is this something that's like actually important to reflect on for you? For some people, it's not going to be important to reflect on, so they might not have those realizations.
Well, can you give,
Yeah,
I'm interested, can you give an example of how somebody who's a victim of sexual assault, how that might materialize in terms of their understanding of their gender?
I want to start with a disclaimer that sexual assault has absolutely no positive factor related to gender development or gender identity. I want to start
Mm.
with that.
Okay, okay.
There is no causation. There is correlation, but that does not imply causation.
Mm,
If someone has been sexually assaulted and they have to really think about what does it mean for me to be a woman, then they're thinking very intensely about their gender and their gender experience.
mm, mm,
They are just as like actually they are more likely to continue identifying as whatever their gender was prior to the sexual assault. They're more likely to continue having that thought process, but with a more with like a deeper realization or deeper understanding or like frankly traumatic symptoms about what it means to now be a woman in this world where I've been sexually assaulted.
mm,
Or for a man who's been sexually assaulted, the emasculation that is paired with that, and how can I then like uphold my identity as a man after being sexually assaulted? And we will often see overcorrection and over adherence to masculine norms to make up for that like feminine violation.
mm.
So the gender politics actually get you like, you almost like entrench more into your gender identity, or rather than become trans,
Wow, so
in order to like compensate.
so this is went in a totally different direction than I was expecting, but it's so
Mhm.
fascinating because it shows how much gender expression
Mhm.
is tied to our social experiences and
Yeah.
trauma, and it's that includes just what we would say, just cisgender people, that your expression of gender can be impacted a lot by trauma and by
Hmm.
culture and all these different factors. And I think that says a lot about maybe by having empathy for how fluid even gender identity and expression can be within a category like cisgenderism,
Hmm.
that can maybe then take a next step and say that there's even more ways of experiencing identity that doesn't have to be confined to what we call masculine and feminine or whatever the words we use.
Hmm. Yeah, I love masculinity research. It's one of my favorite things out there. Because like there, like if we're like thinking like if you're thinking about gender as like these like boxes that you have to check, you are going to have a very limited experience that's frankly it's not going to be satisfying for you or the people in your life. And no, literally nobody wants that. But that's what people think gender is. They think it is this miserable experience. Whereas like you can be fun, you can be creative, you can look however you want to look and still have the experience like, no, I'm a man or I'm a woman or I'm non-binary or I'm whatever. And once we kind of like free ourselves from those like confines of how we like really experience what gender is to us, we can think about more as like gender expression as performance art more than anything else. So how do we want to perform our sense of self to other people?
Mm,
Right. So like for example, I don't think you've ever seen me wearing like monochrome or like all black because I don't have that in my wardrobe at this point because as I've been like growing and developing as a person, that has been a place I've really specifically taken my expression of myself as I simply don't wear that.
mm,
During the summer, I dress like a divorced dad. During the winter, I dress like somebody's grandma,
mm.
and that's fine. And I love that for me. But that's how I perform those like aspects of my identity in those different parts of the like seasons.
When we're talking about gender identity and just
Mhm.
being yourself in the world, how do you how do you view authenticity and how do you I guess how do you think of authenticity and being yourself? How do you integrate that?
I think in order to understand authenticity, that you first have to understand what feels good to you, not understanding yourself. I think a lot of times we think that you have to understand yourself in order to be authentic rather than understand, like, oh, I don't know why this feels good to me, but it does.
Mm,
And then sitting with that and exploring what about this feels good. So there is a young person who I work with who, over the course of our time together, has come out as trans, which has been very exciting. And a lot of what their work was related to, hey, I did this thing that like I was scared to do, and now that I did, I feel way better. And so
mm,
as they were exploring that, and they were trying to make sense of it, especially from their own cultural background, that really gave a lot of like development to like how they thought about themselves.
mm. Yeah, I think that's such a great way of viewing it that I guess because I tend to think existentially. And so when I
Mm-hmm.
think about authenticity, I tend to frame that around values, which I think is
Mm-hmm.
important, but on an even deeper level, you're talking more around your subjective experience of it's like a more
Mm-hmm.
visceral feeling of this is
Mm-hmm.
where do your feelings and emotions lead you in what direction and using what it's
Mm-hmm.
I'm imagining like the what's it when you're searching for coins or whatever and it's like the beeping you know what I mean.
Yeah,
It's
exactly,
like
exactly.
it's almost like what are those things called?
Metal suckers.
Right, detector. So it's like a metal
Yeah.
detector for your subjective experience of maybe joy or pleasure or what feels good. And that's something that's even deeper than values, right? Values is kind of like an
Mm-hmm.
intellectualized version of
Mm-hmm.
that, I think, fundamentally. So that's really interesting.
And I think honestly, because of like how much work I do with people who are very traumatized or have a lot of or frankly like part of their own like autistic experience or ADHD experience is like having to learn to ignore their own body cues. Oh,
Mm,
so much of the work I do is related to like you need to sit with yourself for like 5 seconds, just figure out where that goes, and we need to explore like what does it mean for you to be you from there. So I also tend to take a more like existentialist approach in like the work that I do, but so I also come from like a somatics perspective, and like we need to start as a very bottom up process for me rather than like a top down process.
mm. Yeah, and I think it should be that way. So I appreciate you framing. I never even thought about it that way. I tend to be more of like in the intellectualizing camp, which is one of my, I think, limitations as a therapist.
Sure, sure, sure,
So
sure.
thinking about it, so for people that might watch this, when you say somatic, you start from the bottom up
Oh,
from the somatics. What does that mean?
yeah. So somatics. I think all my clients have seen my shitty little drawing of a nervous system. They all know it. It's got a little brain. It's got some shitty lungs, a shitty heart, shitty stomach, and then like some shitty intestines. And sometimes I do like the little nerve fingers on top of that. It's very fun. It's very bad. Um, So I always start with that, just like side education of like where we're going and what we're doing, and then how does your brain actually connect to your internal organs? How do your internal organs connect to your brain? And what do those signals tell you about what you are actually experiencing out in the world? And what do those experiences then tell you about yourself and about your way you understand other people? So somatics is very much just like a very body focused therapy and understanding what is happening internally for you before doing anything else,
Mm,
because you're not going to be able to cope with a trigger if you don't know what is causing the trigger.
mm,
You don't know what you're going to be able to actually, you don't know how to manage emotion if you don't know what emotion you're trying to manage. Coping skills don't work if you don't know what you're trying to cope for. What does happiness feel like in your body? What does anger feel like in your body? What does anxiety? Have you ever experienced these things? And oftentimes, what we get, especially with men, is we get this like blurring of emotion because of the way that men are socialized to experience emotion, especially from like more like hegemonic point of view. So men tend to have alexithymia, and alexithymia, just for the purpose of this, is the inability to express, identify, or feel emotion.
mm,
And it is something that can be socialized because you learn to repress it and shut it down.
mm,
And so people have been through a lot of traumatic experiences, or men, because frankly, masculinity is a really traumatizing experience in this country. Um, you tend to learn to shut that down. And then if you learn to shut it, once you learn to shut it down, it's pretty hard to get back online. So a lot of the experiences that you have are coming from this place of like, I did this thing, but I don't know why I did this thing. And all my relationships are falling apart. And my girlfriend's unhappy with me because I don't know how to like talk to her about a feeling.
mm, mm.
So what it looks like is it looks like, okay, so when's the last time you felt anything? Or when's the last time you felt angry? What did that actually feel like in your body? Did it feel like your hands were vibrating? Did it feel like you got really hot? Did it feel like you needed to run? And we kind of start there. A lot of like movement motions, so especially like the chest and the stomach, is did it feel like something is sitting on your chest and pressing down? Did it feel like something is squeezing around your heart, twisting it? Did it feel like you had heartburn? Did it feel like something was pushing your heart, or did it feel like it was compressing it from either side? And
Mm.
getting really detailed, so those more somatic or those like more movement based descriptions can really help somebody identify what is actually happening in their body and tell them the cues to actually look for when they're experiencing an emotion.
I could imagine by talking about these somatic experiences, eventually you get closer to the more conceptual aspect of it, to where a guy might be able to label what he's feeling as being sadness or anger.
Mm-hmm. That's the goal.
Wow.
That is truly the goal. And then from there, like the work actually starts once you can like identify those emotions.
What you're telling me, it seems like a lot of straight cisgender men could probably benefit from working with you. It's kind of a loss for that.
Uh, yeah, honestly, I think everybody would benefit from like sitting down and actually exploring like what gender means to them and like really
Mm.
sitting with that. Because on the other side, you will come out with a new understanding of yourself and a new experience. And I do think it's a shame if people don't like take the time to consider that. Because you'll probably come out like with the same idea of yourself as like what you went in with. It's just like now you understand why you're doing what you're doing. It is unlikely that if you sit down and think about your gender, you're gonna be like, okay, I guess I'm trans now. Like that's just simply not how it works.
Yeah, I guess for me, I've never really done a lot of gender work because I take for granted that I just identify as a cisgender man. And I could probably
Mm-hmm.
learn a lot about myself if I actually went to that place.
Very like very existentially, just like what does it mean to be a man? Just
Mm,
that question by itself is loaded.
mm,
Or like
mm,
what does it mean to be a woman, or what does it mean to be XYZ? This honestly, I love doing identity work because like so much of it is like this like what does it mean to be X, or what does it mean to like have this experience?
Hmm.
And then like the nuances of that, like you can really pick it apart and tease it apart.
All right, well, we're out of time, but I really appreciate you doing this. I learned a
Yeah,
lot,
great. That's always the goal.
and maybe we can do this again sometime because there's other questions I have and things like that. I think this could be really informative for people. All right, see you later.
All right,
All right,
bye.
bye.